I have been an editor of the Journal of Hand Surgery for quite a long time, with a bit of a gap actually in the middle. And it's been a very interesting experience, which has actually taught me a lot. This is my current page on the editor's website for the journal, which tells me what kind of work I'm doing. Now, I've been an editor since the journal was paper-based. In fact, the submissions came in by post and were sent out by post to reviewers and so on, and then sent back and so on and so forth. Now, of course, it's all done electronically, and that's very, very much more efficient and a lot cheaper to run. Now, when I look at it, since the journal's been done electronically, I've dealt with 1,600 papers, and I've probably dealt with the same number when it was a paper-based journal. So that's quite a lot. Currently, the assignments with decision means that those assignments that have been sent back to authors for further work to be done. And basically, this is what this talk is going to be about, how you can polish the paper so that it's acceptable with minimal revision. Now, the first thing I should say is that journals want to publish papers. That's what they exist for. And your paper is going to be accepted if it's new, if it's true, and if the information in it matters. These are what the questions that reviewers and editors are asking themselves when they're dealing with papers. But of course, the information needs to be clearly presented and understandable by the reader. And that has to be said often not the case. So this talk is basically going to concentrate on these latter features of presentation and comprehensibility. Now, just because somebody's a good research worker and can think up a research question and plan a study and so on, doesn't necessarily mean they're going to be a good writer. That's quite understandable, because you learn to be a good writer by practice. But lots of advice is available. So it's worthwhile looking at one of a publication. I've shown an example there that tells you a lot about how to write papers or write successfully. And also that kind of publication will help you when you are reading papers and are analyzing their content. The editor of a journal, or all the editors, are there to help the authors. They want the publication of your paper, but they want to help you get it into the best shape it possibly can. And one of the first things to do is target a journal that's most appropriate for your study. And when you've targeted that journal, look at the submission guidelines for the journal and look at papers published in that journal so that you know what the readers are looking for and the presentation style. So let's look at the structure of the paper. Now, we all know the IMRAD structure: introduction, methods, results, and discussion. But there are two other things that aren't covered by IMRAD, and that is the title of the paper and the abstract. Now, when you're writing a paper, that is usually the sequence that the paper is written in. Start with the introduction, followed by the methods, then the results, then the discussion, and finally, just to fine-tune the title and the abstract. And I'll be dealing with all these points as we go through the talk. The introduction, it's usually far too long. And I can't make the point too strongly that a paper is not a thesis. Now, a lot of papers are based on work that's been done for a thesis, which involves a lot more historical research to be in the thesis than is required in a paper. So you don't want to cut and paste a huge amount of irrelevant material about, say, the history of Dupuytren's disease from the word go. A paper is not a thesis. You want to briefly introduce the topic, not write up everything that is known about it. You want to put in a line about what's not known and what is debatable, because that introduces your explanation as to why your study was done. And the aim of the study should be stated in the ultimate or penultimate sentence of the introduction. Some authors like to follow this with a hypothesis in the final sentence saying, our hypothesis was such and such and such and such. Now, in clinical papers, that can sound a little pretentious and is not strictly necessary. It also gives a little hint of the scientific misdemeanor of harking, and that is hypothesizing after the results are known. You find something out and then you think, well, we'll say that that confirms our hypothesis, which we haven't actually stated yet. So be a little bit wary of the hypothesis. The methods section, very, very important, as indeed are all the sections. It's helpful to use subheadings, even if the journal doesn't use subheadings. When you're actually setting out the methods, you can have a list of subheadings that you're working to. And if it's a clinical study, you start with the patients and participants, and in particular, the inclusion and exclusion criteria, and also state clearly if any patients were lost to follow-up. Describe the techniques you use, describe the equipment that was used. The statistical analysis section, I'm not going to go into in detail, but just to mention some of the common errors in this section. First of all, there's often not a clear statement that the distribution of the results was tested for normality. The statistical tests used are not clearly stated, and they're not clearly stated about which test was used for which set of results and so on. Obviously, you're going to get statistical advice before the study even begins. That certainly isn't the time to do it at the end. But that's all I'm going to say at the moment about the statistics. But I would emphasize that the methods used in the study must be 100% clear to the reader. They must not be obscured in any way. So then we come to the results, and it has to be said that these are often very poorly presented. And once again, some common errors that one comes across time and again. Stating the same results in multiple formats, such as in the text, in the table, and in figures, it doesn't make the results any more credible. You should state them once only in the most appropriate format, whether it be text, table, or figure. Using inappropriate precision for the results, particularly when presenting mean values. And this we see very, very commonly in inexperienced authors. If you're using a goniometer to measure the movements of interphalangeal joints, that probably has a precision of about 5 degrees at best. So presenting a mean value to 1 decimal place of a degree is ludicrous. Likewise, if you're measuring something with a ruler, you can't measure to 0.1 of a millimeter. The numbers in the results don't add up, and I'll come back to this shortly. And the misuse of percentages, so that you present percentages with a number of different denominators so that the percentages actually become meaningless or extremely difficult to follow. So when presenting the results, you may be presenting them as tables or figures or clinical illustrations, whatever. When you're presenting a table, do not present a table with all your raw data. The reader is interested in how you analyze those data and what conclusions that you came to. And it's very important, again, to follow the format of the journal. Papers don't magically transform themselves into the format used by the journal during the editorial process. You are supposed to present them in the way requested by the submission guidelines. So here we've got an example of a table that is basically a spreadsheet with all the raw data in the study. And it's not going to be particularly helpful to a reader to analyze all those 25 patients individually and see what happened to them all. That should be summarized. The information in that should be presented in a much clearer and better way. Sometimes a large and complex table is okay to be presented as an online file that interested readers can access, but not within the actual printed paper itself. Now here's a table that looks a bit better. This is a table of ulnar-sided wrist pain diagnoses and giving their frequency. But when you look at it, it rapidly begins to unravel. The frequency will only be meaningful if we also know how many patients we were dealing with, and that's nowhere stated. And it's always better to define abbreviations and below the table usually. Also, this table has a lot of boxes in it, and it's got lots of horizontal lines, but it's not very clear why those horizontal lines have different weights. Now, if we look at the table when it's been formatted more correctly, then we know that 155 patients were being dealt with, and that the most common diagnosis was ulnocarpal impaction with a frequency of 116 out of 155 patients. All the abbreviations are defined below. Now that means that all the information is available in that one table. The reader doesn't have to look elsewhere in the paper to discover how many patients were being dealt with or what the acronym HALT means, for example. It's all there. And while I've been talking, I'm sure that most of you have spotted that the column under frequency does not add up to 155. It adds up to 154. Now, you might have a column adding up to more than 155 if patients had more than one diagnosis, but you can't possibly have less than 155 if you've got 155 patients. And that's an example of, you know, when you look at it, the numbers don't add up. And believe you me, this happens a lot. Charts and graphs. The basic rule is just keep them very, very simple. Here's two charts with the same information. This information is the prevalence of the Dupuytren's disease in men and women. And on the left, you can see a number of problems. It's over elaborate. It's three-dimensional but distorted. The numbers are all on the columns, but you might just as well have put those in a table as produce a chart. And you can see that the fonts are different types of font. You should always use a sans serif font if you possibly can. So now we see on the same information on a different chart, a much simpler chart. The font is legible, it's in size, it's in sans serif, and you can see right away that the prevalence or the relative proportion of patients with Dupuytren's, the number of females or women affected increases with age. Now, there may be many reasons for that. There may be more women about, or it may be because duplicons becomes increasingly common. That's not what this chart is intending to show. It's just to show the relative proportions with age. So keep it simple. That's the most important thing. Now, images, obviously clinical images are very, very important in a clinical journal, but first and foremost, they must be anonymous. The patient must not be identifiable from the image, and crop the image, always crop so that you're focused on the most important point and any external clutter is removed. You should always ask yourself when putting in a clinical photograph or clinical image, would the point be better shown with a diagram? And quite often the answer is yes. And sometimes it's important to add a symbol or arrow, for example, to point out important features. Now here's a couple of examples. One on the left is showing the reconstruction of the muscle structures after a wrist arthroplasty. That's what it's supposed to be showing, but what it's actually showing is the surgeon's hands and a swab and all sorts of other things that are quite pointless. So that needs cropping up. The one on the right is supposed to show the step in a technique of flexor tendon repair. It has a label on it, which is probably not a good thing, and it certainly looks a bit amateurish. And probably this technique is better shown with a diagram rather than a clinical photograph. And again, here's another case, just to emphasize the points I'm making here. On the left, a cluttered image of, in this case, extensor tendon repair, which doesn't really show clearly what it's attempting to show, which is that the suture is put in with the knots buried. And with closer cropping, then that is more immediately apparent. So we've presented the results now. Now we're going to discuss them. Oh, sorry, there's another picture I put in here. This is just a radiograph. It's just to show that any picture can be improved. This isn't a bad picture on the left here, but with a little bit of simple photoshopping, only takes a few minutes, you can get the exposure corrected. I put on a little arrow, but we can all see, of course, it's an ulnar collateral ligament avulsion, but any image can be improved with just a little bit of work. Yeah, so now we've presented our results. We've got our tables, we've got our charts, we've got our clinical pictures. We're moving on to the discussion. And it has to be said that most discussions are far too long and they're very poorly organized. Discussions have a fairly straightforward organization, which once you know it, is very easy to follow. If you don't, then they will become long and rambling and discursive and speculative and really of no help to anyone. So the structure is to start by summarizing what the study found. Don't repeat the numerical results. You've already given those. What you found, what this paper found in the first paragraph. Then you can compare and contrast your findings with those of similar studies. Then you can identify the weaknesses in your studies, and also you can highlight the strengths. Don't be too boastful about that, but if it's showing something with strong evidence, then that's good. Don't claim priority. This is the first ever example of such and such and such and such. Quite often it isn't. And in any case, if you are the first, you will have this attributed to you by your fellow scientists, and you don't need to claim priority. And at the end, you can certainly mention ideas for further work. If you wish, You may want to keep them close to your chest because you're already working on them. It's up to you, but don't end with a sentence saying that further research is required, because further research is always required. Finally, the reference list, and only include the most recent and pertinent. Remember, a paper isn't a thesis. Having dozens and dozens of references does not make the evidence in your paper any stronger. If you refer to recent articles in the same journal, it improves the impact factor, and editors always like to see their impact factor improved. So that's, again, a useful little tip. And of course, always use the right format for your particular target journal. So then we come to those other points, the title and the abstract. And those are the two things that people read. They might not necessarily read the full paper, but they will certainly read the title and they will certainly read the abstract. So the title should state what the paper is about unequivocally, so that it's perfectly clear, so that researchers and clinicians can find your work. A lot of people like to use or have a title that is a question, but I'm not particularly fond of that, because the question is what the aim of the study, basically, not what the study found. And sometimes the paper doesn't answer the question, which negates the whole thing. Again, a sort of jokey or whimsical title does not entice the reader in to read your paper. It will often put them off. So just be sensible and straightforward. And finally, the abstract. That's usually the only part of the paper that's read, and it should state clearly what you did and what you found. When you're writing an abstract, follow an internal structure. Some journals have subtitles within the abstract, some don't, but you should work to the internal structure that I've listed here. What type of study was it? Was it a randomized controlled trial? Was it a cohort study? What was the aim of the study? Where it was done, in the community, in a teaching hospital? What method you used, what you found, and what conclusions you drew. So again, if you follow that format, the abstract will pretty much write itself. You also have to provide a level of evidence for clinical papers, not basic research papers. And that varies from a level 1, which is basically a meta-analysis of good quality randomized controlled trials, to level 5, which is a personal opinion. And these are drawn up by the Oxford Centre for Evidence-Based Medicine, and their website will give you the full guidance. And I have to say that most authors wildly overestimate the level of evidence of their clinical studies, when most types of clinical studies are level 4, that is a cohort study, which may be retrospective, and sometimes they're submitted as level 2 or even on occasion level 1. The editors set the final level of evidence. So the writing process, I've gone through the various sections. Obviously, you've got to write a first draft, but the important step after the first draft is to let other people see it and criticize it, because they will point out things that you have overlooked. And then you revise it, and then you put it to one side and revise it again and revise it again. The more revision and more feedback that you have, the better it will be. Now, as editors, we're very impressed by people who submit papers when English isn't their first language, and we will give you every help to improve any problems with the English language. But a basic rule, and this goes for English language speakers, is keep the sentences short and clear, writing for an international readership. And there's a tremendous temptation to use jargon, vague words, fashionable words, pompous words, overused words when writing a paper. And this has to be fought against all the time because the use of this kind of language is contagious. I'll give you a couple of examples in a moment. Try to avoid excessive use of abbreviations. Sometimes papers, particularly ones involving microbiology, genetics, and so on, have a lot of abbreviations, and it's best to define those in a separate table so that the reader can refer to them as required. But as a general basic rule, try to avoid excessive use of abbreviations, and once again, have the paper read for ambiguity, mistakes, and so on, and to clarify the English language. The language will not be the sole reason for rejection. We will do everything to help you get your paper published if it's new, true, and it matters. That's the editor's job. I'll just show you a couple of examples. An evaluation of the impact of A on B was performed. This is a passive voice, which is the standard way of writing in science when something is done to something else. There's a fashion at the moment for using active voice. So you would rewrite that sentence as, we performed an evaluation of the impact of A on B. The sentence is exactly the same length. So how has that been improved? As I say, the proponents of the active voice have sometimes a quasi-religious approach to this, but you have to be very careful when using it because you will often find that you're starting every sentence with we, which is very, very, very tedious for the reader. Now, what does that sentence mean? We performed, overused word. Evaluation, imprecise word. Impact, again, overused. What you're really trying to say is we measure the effect of A on B. So always, always try to be short and clear. I'll give you a couple of examples now of jargon words. Trajectory means the path followed by a moving body when acted on by external forces. I can guarantee that just about every paper talking about a screw in the scaphoid will talk about the trajectory of the screw, when what they mean is the direction of the screw or path of the screw, likewise for K-wire. These are just a couple of examples. Emergent means coming out. It doesn't mean emergency. So you get sentences like, we treated the patient emergently, meaningless. Patients don't fail treatment. Patients who failed treatment were treated in such and such a different way. What happened was the treatment failed to help the patient. Not previously reported in the literature. Get that red pen out and get rid of extraneous words. So, I mean, these are just some simple examples. There are dozens. And this is what the editor does to try to tidy all this kind of thing up. And that's the editorial process. On the left, in the good old days with the red pen and the paper, submission printed out on paper, and in the electronic file, this can be done with track changes in Word. But it's a very long, patient job to polish up a paper so that it's acceptable from the point of view of the journal itself in many cases. Not all, some submissions are excellent in every respect, and I compliment the authors. So I'm going to summarize here the common errors that we deal with in the editorial process. Seeing what is basically a first draft, it hasn't been read by others, it hasn't been criticized by others. Papers submitted without reference to the format requested in the submission guidelines. The abstract that doesn't follow the structure that I mentioned. The long, rambling introduction that is perhaps a cut and paste job from a thesis. The methods that are not clearly stated or are obfuscated. The results that are poorly presented in the ways that I've mentioned earlier in terms of numerical information or overstating the results as an overemphasis and repetition, with poor quality tables and figures. All these points I've tried to deal with, and the poorly focused and overlong discussion. And finally, the incorrect citation and reference style, or missing references. So in summary, I would say keep it short, keep it simple, and keep it clear. All the classic papers follow those rules. And I can't finish without mentioning the scientific crimes and misdemeanors that crop up. Plagiarizing other people's work, salami slicing your own data and trying to present them in several different publications rather than publishing all the data in one paper, or submitting basically the same paper to several journals. You will be found out if you do this, because all journals use sophisticated computer software to identify plagiarization and repeat publication or attempted repeat publication. Adding authors who haven't actually contributed much or anything and are not defined as true authors. And finally, out and out fraud, inventing the material in your paper. Now, you may think that, oh, nobody would do that. But unfortunately, none of these crimes or misdemeanors is all that uncommon. And we have to be on guard to pick them up all the time. So I hope you've found some useful tips in this presentation, and I wish you good luck with your submission. I'll be very happy to answer any questions, and thank you very much for your attention.